As always, we're joined by Dr. Syed Hussain of Trinity Health of New England to talk about the topics that are trending in the world of health and medicine. Good to see you again, sir.
Likewise, Tim.
Glad to have you here. Unfortunately, not great news to start with, that we're seeing cancer rates rising in young adults. To be more specific, we're seeing more diagnoses. I always know the first question I have to ask is that just because we're getting better at detecting cancers, or are we seeing younger adults getting cancer more often?
Yeah, I know, and I know you've asked me that question
Yes.
before too, Tim. So we are seeing more incidents of cancer, especially colon cancer, in an age group where there is no current screening guidelines attached to them. And this is the age group from 19 to 49.
Yes.
And as you may know, screening guidelines usually start at the age of 45 and go up. So what do viewers need to know? So first of all, your own risk assessment. The American Cancer Society has come out with a new risk assessment tool that can be found on the American Cancer Society website, Cancer Risk 360.
Yes.
That should be used in conjunction with a discussion with your healthcare provider to understand what higher risks you may have, whether it's smoking, lifestyle related, a family history of cancer, all of those taken together, and whether you are eligible for earlier screening.
Yeah.
I think that's really, really important until we find more definitive answers as to what are the drivers? Why are we seeing this? There's been discussion that has taken place in the medical community about sedentary lifestyles and eating habits, etc. But that
processed foods, red
yes,
meats.
but that's not the whole picture, though. And so there's more answers, more research that is needed. But in the meantime, know your risk. And don't be afraid when you see some red flags, some warning signs, symptoms that you've not experienced before that are not going away. Seek medical attention. Don't be shy.
Yes. Now, there were the colonoscopy screening guideline went down from 50 to 45 because of this. Do you think maybe it might be pulled even earlier to like age 40?
Yeah, it would be based on evidence, based on what we're seeing. More research is needed, like I told you. But in the meantime, though, do your own personal risk assessment. If you feel you have, a family history of cancer, for instance, smoking, all these other risk factors that may increase. Remember, 45% of cancers, Tim, are associated with a modifiable risk factor. That's almost half of all cancers.
Yeah.
Modifiable risk factors. So the onus is on us. If we see something, say something, talk to your healthcare provider, seek medical attention.
And just to put a slightly finer point on what you had said earlier, not just colon cancer. We are seeing a rise in other cancers in that same age group, too.
That is correct, yes.
Wow. All right. We're also seeing a rise in tuberculosis cases. Not that there's a lot, not a wide sweeping amount, but anytime we're looking at relative increases, of course, you want to keep an eye on it. What is driving that?
Yeah, so the risk to the public remains low. I don't want folks to get alarmed or anything. TB is caused by a bacteria. Tuberculosis has been around for hundreds of years. Actually, in the late 1800s, Tim, 1 out of every 7 Americans died from TB.
Yeah.
This is prior to antibiotics and really important public health measures that we were able to control the spread of TB successfully. Why we're seeing an increase? Last year we had more than 10,000 cases. That's the highest in over a decade.
Yeah.
Most of those cases, a majority of them are related to travel. International travel and migration from countries where we see a higher incidence of TB to begin with. And then a smaller percentage of patients in the U.S. were immunocompromised. So they're more at risk for developing active TB.
You had mentioned antibiotics. Let's finish with some good news. There is a new antibiotic out for treating urinary tract infections.
Yes, Blue Jepa is a new drug that's been manufactured by GSK. It belongs to a class of antibiotics called triazosynaphthalines. It's a bit of a mouthful.
But basically, for you for saying that.
This antibiotic class works by targeting 2 enzymes for E. coli. E. coli is one of the most common bacteria that causes urinary tract infections, especially in women.
Yeah.
And it by targeting those 2 enzymes, it prevents the replication and survival of E. coli. This is important because we see more and more drug-resistant bugs.
Yep.
And so this drug is approved for uncomplicated urinary tract infection in women and girls above the age of 12.
Okay, I was about to say, we already have antibiotics that generally will treat a UTI pretty quickly and efficiently. Why is this such big news? And
because we're seeing more and more drug resistance. It's always good to increase the tools in your arsenal.
Yes. Last quick question, and I know you can't answer this. You had mentioned E. coli. That causes more problems than just UTIs. Maybe is this a pathway to find out if this drug or a similar drug could fight E. coli infections elsewhere in the body?
Yes, and there are other mechanisms to combat E. coli if it's not related to the urinary tract, just so that viewers are aware, but this is only for uncomplicated UTI, this drug that got approval.
Okay, thank you so much. Good to see you again. And
Likewise.
remember, you can ask a question that Dr. Hussain can answer during our Health Watch segment. Just send it to us by using the keywords Health Watch. Send it to 860-527-6161. Now here's what's coming up.